The promise of a national Pharmacare program intended to give all Canadians better and cheaper access to medicine is beginning to crumble before it's even been implemented. The Alberta government now says it's not interested in the federal plan. Neither is Quebec. The federal government is expected to table the first piece of Pharmacare legislation this week, which would cover the costs of diabetes medicine and birth control. David Akin explains why two provinces are saying no thanks.
Well, Donna, for Quebec, this is standard operating procedure. It has been opting out of federal government programs for decades. But when it does, Quebec generally receives compensation from Ottawa to set up its own provincial program that will match the one that Ottawa was offering. But with the National Pharmacare program, another province, Alberta, is ready to follow Quebec's lead.
We want to avoid the bureaucracy. I don't think the federal government understands that provinces do have processes in place. They have suppliers. They have an administrative network already set up.
And while Quebec has not signaled what it will do with the extra Pharmacare cash, Alberta is ready to use it to enhance existing provincial coverage for diabetes and birth control drugs.
We would be absolutely willing to enhance those programs. All we need is the federal government to provide those dollars to us, and we will make sure that we enhance the programs.
Diabetes patients in Alberta see the decision taken by Premier Danielle Smith's government in a political light.
She just wants to own the libs. That's really all I think it is, honestly.
But Sean Hanley thinks the federal plan could save him hundreds of dollars a year.
I think it would save a lot of people a lot of money. I don't see her problem with it.
If you're paying daily for a life-saving medication, you're going to factor that into your decision on where to live.
Kristen Stringer has 2 kids with type 1 diabetes, and she worries that once they leave the home, they may have to leave the province.
Both my children have expressed a desire to potentially look outside of Alberta, knowing that they may not be able to receive coverage as adults.
As for the federal health minister, he says everyone is getting ahead of themselves.
The first thing I would say is everybody just needs to take a pause. For provinces to say whether or not they're going to participate in something or not when they don't even know what it is a little premature.
And Ottawa says the legislation, which will contain answers about timelines and coverage levels, compensation for provinces opting out, that could be tabled as early as Thursday. Donna.
Okay, David in Ottawa, thank you.